Hi, everyone. My name is Tori Ford, and I'm an academic and an activist working to advance gender health equity.
And so the reason we're here today for the career show is to kind of talk about charity sector and the non-profit sector and how people can get into that and what it's really about. So could you give kind of a quick overview of what your non-profit is and how it was started and why, basically?
For sure. So I'm the founder of Medical Herstory. We're an international award-winning youth-led not-for-profit, and we're on a mission to eliminate sexism, shame, and stigma from health experiences. I founded it in 2019 after my own experiences of living with chronic illness, facing medical dismissal, and really feeling like I kept telling this medical history over and over and over again and not really being heard. And that's when I had this idea of thinking about how we could change the way that we tell and listen to stories, and coined the term of a medical herstory, which is a feminist way of listening and really focusing on empowering patients and letting them share their stories in ways that feel good for them. So since then, we started with my own story, and now we've shared hundreds from people all around the world. And we've taken those stories into classrooms in medical schools, working to change curriculum, as well as being used to empower patients to advocate for themselves.
Yeah, I feel like the different experiences between men and women in kind of the healthcare sector is so profound, especially like I have a younger brother and you can just see the differences when like we have the same illness, or like if I have like a female specific illness, like it's just not treated the same.
Mm.
So in terms of like the healthcare system, what aspects of female medical issues do you think are currently overlooked?
Yeah, so you're definitely spot on. What we've seen is that within women's health, there's really this double bind. So the first problem that sort of is encountered is this problem of the trust gap. So when women and gender diverse people seek out healthcare, we know that historically and currently they're more likely to be dismissed as being overly emotional or dramatic, or that their pain is all in their heads. And they're actually more likely to be prescribed things like antidepressants, while men are more likely to get painkillers when presenting the exact same symptoms. So we've seen these tensions there. And then on the other hand, you have the research gap, which refers to the fact that conditions that differently or disproportionately affect people assigned female at birth are really underfunded and underprioritized, which means that even when physicians believe patients and want to care for them, as so many do, they often lack the resources and answers that they need to give that adequate care. So there's sort of these two aspects going on, and I think there's also a lot of internalized shame and stigma that often women and menstruators feel about their own bodies, and that's definitely something we're working on overcoming.
Yeah, and particularly with menstruators, it kind of feels like if you have any kind of problem relating to like periods, you just get told to go on the pill. That tends to be the overarching response, especially for people my age. So like early, like late teens, early 20s, it seems to be everyone is on the pill at some point and everyone experiences it so differently. And everyone's on it for different reasons, but there's just some inequality there, I think. With like the next few questions, we could focus a bit on like female sexual health, more specifically. So like if there's a woman who's kind of feeling overlooked by her GP, when she's gone to them with problems, what sort of advice would you kind of give to someone who's going through that?
Yeah, definitely. So I've learned so much from my colleagues at Medical Herstory about self-advocacy, and really gaining confidence in that space. And while it's very difficult, I think what I would first iterate is that, you're not a bad patient if you're not getting the care that you deserve. I think it's often easy to sort of not be able to see the structures that are at play, and how sexism, racism, ableism, transphobia, all these different structures can really become magnified within clinical encounters. And I think there's often this disservice that we do to healthcare professionals when we put them up on pedestals and say that, they have these magical powers to cure all disease or harm. That's really not the case. So I think what I would really encourage any woman or anybody who's seeking out healthcare and not being listened to is that it's not your fault. And then definitely, I think medical encounters can feel like you're really disempowered, but I would encourage them to know that you are in control in those situations, and that you have the power to self-advocate, to say no to certain treatments, to ask questions, and to ask to be referred out if you feel like you're not being listened to. So Medical Herstory has amazing workshops, which are rooted in lived experience about how to advocate for yourself within healthcare. And they're honestly all the lessons that we wish we had known at the start of our healthcare experiences. So
Yeah.
from little things like knowing that you can self-swab for an STI exam or insert your own speculum for a pap smear, those are really empowering to know. And also some great tips about bringing a friend with you if you can, writing down your questions, and making sure you treat yourself afterwards, because self-advocacy is so, so important, but it's really hard work at the end of the day.
Yeah, definitely. And I kind of feel like with like sexual health, especially, a lot of GPs, as you said earlier, like there's such a lack of funding and resources in that kind of sector within healthcare that the GPs themselves are not empowered because they kind of unwilling to diagnose or they're unsure. So like especially with things like vaginismus, women get overlooked time and time again. And I was just wondering kind of how can we change that, kind of empowering ourselves, and because a lot of the GPs that look at cases like this are also people that menstruate. So it's kind of like how can we empower ourselves and those GPs to kind of take the steps to.
Exactly. Yeah. So the problem of gender bias in medicine isn't really this binary of, male practitioners wielding all the power and sort of vulnerable, agentless women sort of under their control. It's really much more complicated than that. And that's why we see that sexism within medicine is pervasive and it's there regardless of the gender of the practitioner. And that's because sexism is a structure we all need to work together to eliminate. And I think something that we need to be doing more of is having conversations. I think there's a lot of barriers between GPs and patients that prevent them from having open and honest conversations about expectations, about perceptions, about assumptions. And often what we've seen, especially my own research, so I work now within primary healthcare, is that there's often very different perceptions going on of what's happening. And I think whether that's through research or activism, we can start some of those conversations to talk about, for example, one of the recent studies that's come out of our department is that with endometriosis, which takes on average about 7.5 years to diagnose, patients feel that they're not being listened to, they're being dismissed, they're being told it's normal to be in that much pain. But then GPs are really struggling because they don't want to scare patients with a scary diagnosis. They don't want to have to recommend surgery to get the diagnosis and be wrong about it. There's a lot of factors that go on both ends. And at the end of the day, physicians care about patients and patients deserve good healthcare. So I think we're all on the same page there. And I think there's a lot of ways that we can work together to address what are some of the issues at hand and how we can work together to dismantle them.
Yeah, definitely. And kind of, I guess with Medical Herstory, kind of the platform that it provides women, what kind of impact do you think being able to share those stories kind of has on the wider community?
Yeah, so telling stories, I believe, is the most powerful thing we can do. I think not only for empowering yourself to get your words on a page or get your story out there and have your voice be heard, but also to make others feel less alone. So we've seen that with narrative storytelling over and over again, that when you see yourself reflected, that gives you some power back. And stories, whether they're told through writing or whether they're at the events that we hold or whether you're doing, patient-led research, all the different ways that storytelling and lived experience get integrated, I think reinforce that people are the experts of their own experience, and really rooting that and centering that, I think, is the way forward with all of healthcare and research, honestly. And I think I'm really privileged to give people that space to share their story in a way that it will be respected, that they can share as much or as little as they want. And it's a safe space to do that where they'll get a lot of support.
Yeah, and when I was having a look at some of them, a lot of them, the stories, I was kind of surprised at how common certain experiences were. So I feel like a lot of the time people kind of go through these experiences by themselves and they don't realize that it's like a widespread thing to experience this, and kind of having that platform is really, really helpful for a lot of young women, I think. And just if we kind of move towards the kind of career service kind of questions, how is there any ways people can get involved in the organization?
Yeah, Medical Herstory is always looking for more volunteers. We're currently a team of over 100 volunteers in 7 countries and 24 universities, and always looking to expand. Whether you're interested in media, graphic design, publications, writing, workshops, we've got something for everybody. In addition to that, we're always looking for new audiences to engage with our workshops or to co-host events with us. And you can always donate to our feminist health fundraisers to keep supporting our work as well.
Great, yeah. And in terms of like how your like career journey, how come you kind of in 2019 decided to go down this path?
Yeah, so I actually come from a background in gender studies. I've always been really interested in sex education. My grandmother taught sex ed at our local high school. So I've always been really open about that and really interested in it. And I went to McGill University for my undergrad and sort of started exploring the area of the social studies of medicine and became so interested in medical history, sort of learning about these concepts around hysteria and sort of how women historically have been treated and seeing how prevalent it was to today, got me really excited. So then I actually went to Cambridge, and coming from such an interdisciplinary background, gender studies is so broad. I felt a bit of pressure to try to fit into a box. You know, was I going to be a medical historian? Was I going to be a gender studies professor? Where did I sort of fit? And that's where I found the program called Health, Medicine, and Society. And it was on a total whim. I was Googling one night, you know, cool programs, new programs. And it was just 2 years old and was exactly what I was looking for. It was an interdisciplinary program of sociology, anthropology, philosophy, and history. And I'm so, so glad I took it, because in that program, I got to learn from such amazing professors in reproductive sociology, and really fell in love with medical sociology. I had no idea it was a topic before, but it was exactly what I wanted to do, and really falling in love with qualitative research. So getting to talk to patients and hear their stories, and those stories being your data, and that was research, was super cool to me. And then after Cambridge, I knew I loved the UK. I knew I loved sort of this Oxbridge system of close supervision and a lot of care that went into students' work. So I applied here at the University of Oxford in primary healthcare, because I saw that it was so patient focused. There's a lot of bringing patient voices into research to make sure that what you're producing is useful and actionable, which I was really excited about. So I do work here now. I study chronic yeast infections, and it's really amazing work focusing specifically on patient and provider relationships and how common gynecological issues are often overlooked or trivialized, but really form a foundational part of patient experiences and sort of cumulative experiences, especially if those first encounters, unfortunately, are negative. So it's been a bit of a whirlwind. It's been really interesting to see moving from sort of the gender studies department into the medical department. So now I get to have colleagues who are GPs, which is really cool. And the conversations are super interesting, but I definitely didn't have that much of a clear path going into it. So if people out there are stressing about, you know, putting all the pieces together, I'd encourage you to just follow your passions, and things tend to fall into place.
Yeah, that's really good advice. I feel like a lot of people, especially like mid-university, feel a lot of pressure to kind of be deciding what they want to do for the rest of their life. So it's quite nice to hear that it's kind of, there's a nice path almost, and not to really stress, because everything will just happen as it does. But yeah, do you have anything else that you kind of want to, do you have any workshops coming up or anything like that that you want to plug?
Yeah, we've so many exciting things happening at Medical Herstory. You can follow us on our social media at Medical Herstory on Instagram, Twitter, Facebook, TikTok, LinkedIn. We're everywhere. So you can stay up to date with us there. But we have really exciting projects coming out, including a feminist health podcast and magazine. And then we run monthly storytelling session. The next one will be on immigrant and migrant health, which we're really excited about. And then every single summer, we have our feminist health research conference. So if you have any research you want to share, let us know. And then, of course, if you have a story that you want to write for our website, reach out to us. We have an amazing team of trauma-informed editors who will help walk you through the whole process. So yeah, definitely don't be shy. And if you also have questions about careers, different paths, figuring out where you want to go or what you want to do next, my door is always open.
Great. Thank you so, so much.